Welcome to this month's Friends You Keep. As they say, we are the average of the 5 people we spend the most time with. And at Erin Wellness, we believe that sustainable health and wellness is an accumulation of 5 pillars: the thoughts you think, the friends you keep, daily movement, nutrition, and lastly, supplementation. So each month on our podcast, we feature guests doing exceptional things that will hopefully inspire you to step into who you are destined to be. Hello, everyone. Welcome to this month's Friends You Keep. I am so delighted today to have Dr. Amber Hall here with me. Welcome, Amber.
Thank you so much. I appreciate the invitation. I've been looking forward to talking with you.
Me too. So Dr. Amber Hall is a U.S. board certified and BC licensed physician who has completed her medical degree and residency training in the United States. She is a Menopause Society certified practitioner and an active member of the International Society for the Study of Women's Sexual Health. Love that. Dr. Hall takes an evidence-based integrative approach to women's health, considering measurable goals within the context of improving quality of life. She has a deep understanding of physical and emotional changes that happen through the lifespan. I mean, puberty, postpartum, perimenopause, and menopause and beyond. In addition to a full-time clinical practice in Vancouver, she writes about medicine. I suggest everybody subscribe to your Substack. Immigration and sexual health at the name Under the White Coat. So here we go. I'm so excited to have you today. We have such a great conversation planned. And so for listeners who are unfamiliar with you, can you share what led you to medicine, your focus on women's health, and of course, your recent move to Vancouver, our wonderful country of Canada?
Yeah, absolutely. I'm so glad to be in Canada, and thank you for that lovely introduction. So I did my undergrad in integrative physiology at the University of Colorado at Boulder. And while I was studying, I was like in my late 20s, I was a non-traditional student. And my cousin at the time was rushing a sorority in the United States, was pushed from the top of a human pyramid and had a cervical level spinal cord injury that basically left her quadriplegic. Wow. And so she was sent to a spinal cord injury rehabilitation facility in Denver that's one of the best in the United States, called Craig Hospital. And while she was there, I spent a lot of time with her and, just talking with the doctors and sort of like being there through her recovery. And one of my aunts was like, you're asking a lot of really good questions. Like, you should go to medical school. And I was like, I'm not smart enough to go to medical school. And she was like, of course you are. So that was really kind of what planted the seed. And from there, I sought out and got an NIH research grant to work at the Integrative Physiology of Aging Lab at the University of Colorado at Boulder, where we were studying like vascular health and aging, telomere length, VO2 max before it was cool, like all these things related to how we age functionally, and did that research for a while. My first job out of undergrad was at the Children's Hospital in Colorado, where I was doing research on insulin resistance in adolescents with type 1 and type 2 diabetes. So it was all about, I had this really good foundation as like a young, hungry, fresh out of undergrad professional in functional longevity, metabolism, glucose metabolism, muscle function, cardiovascular function, and all of this intersection. And in medical school, I thought I wanted to be an OBGYN. So I did all the women's health stuff and the gynecologic stuff and delivering babies and, GYN oncology and breast cancer. But in the United States, your likelihood of burning out and getting sued as an OBGYN are very high.
Really?
And I had an interest in this intersection between like women's health and maternal child health. So I ended up doing pediatrics. I did my residency in pediatrics. I did a year of newborn intensive care fellowship where I learned about high risk pregnancy and delivery, which is where the postpartum stuff comes in. And ultimately, kind of through the course of my practicing peds and like postpartum maternal child health, I started experiencing perimenopausal symptoms myself and was like, whoa, postpartum actually looks a lot like perimenopause from a hormone standpoint. So I started kind of like re-educating myself around the menopause space and, the hormone midlife transition, got my Menopause Society certified practitioner, actually like a week after I crossed the border into Canada. But since I've been here, I'm working at an integrative women's health clinic where I can sort of like put all of these things together in a way that also provides me mentorship on the Canadian healthcare system and on mind, body, and functional things that I didn't learn in medical school. And so now that I'm practicing in Vancouver, I just am so grateful to be in Canada. I feel like my patients are grateful to have me here.
Yeah.
And it really has like kind of been a great new trajectory in my professional development and in nourishing myself.
Well, I mean, you've really covered, if you think the gamut of what happens to women as we age, right? I mean, especially looking at insulin resistance, especially like all of those things. It's like you kind of took a bit from every, I mean, you look like you've done everything, but you've taken a bit from everything and applied that now to support women, which is incredible. Now, you mentioned the Menopause Society, being a Menopause Society certified practitioner. Can you explain why that designation is important, why it was important for you to get that when you came into Canada, and why it's important for women to seek out somebody who has that designation if they're looking for care?
So I think the crux of the problem that so many women are frustrated with right now in terms of not being heard is that we have like two generations of physicians who were never trained on hormone therapy, right? Because the Women's Health Initiative came out in the early 2000s and everyone was like, you're going to get breast cancer and cardiovascular disease and die. Nobody should be taking hormones. It was turned out that study was flawed. It was very well intended, and we still were able to glean some important information from that study. But it really deprived an entire generation of women for these very therapeutic modalities that we're now recognizing have important long-term implications for people's overall health as they age. And so what the Menopause Society certification designation basically indicates is that people have done additional training such that they've been able to take and pass an exam with just the basics of hormone and menopause care to be able to do a risk-benefit analysis. Now, physicians can take that exam, nurse practitioners can take that exam, physician assistants in the United States, midwives. So you have a variety of professionals who have access to be able to get that credential, but it just shows that they have an interest and have done additional study. It doesn't mean they know everything,
Gotcha.
but at least they've done additional training.
Okay. Now, when you have a woman, I get this question all the time. And in my little Navigating Perimenopause book, I kind of put some questions that women can use when they go in to see a doctor. So many women I come across are wanting answers and don't know how to talk to their doctors. They know they get that 15 minutes. And some doctors, I have a great doctor, but some doctors can be very dismissive and just, not paying attention to what they need. So what are some suggestions that you have that you can help? How should women approach their doctor when it comes to conversations about MHT and asking about it? Is there questions and language they should be using to make sure they utilize that 15 minutes of time? And if they feel dismissed, I mean, I think you're going to say yes. Obviously, they should seek a second opinion. But,
Yeah.
But what are some of the questions, and how can women come in empowered to this conversation with their doctor?
So I think it's important to self-advocate, but I also, from the perspective, like playing devil's advocate from the medical perspective, like, there's a lot of doctors who simply weren't trained in this. So I think that question number one is, I feel like I'm starting to have some symptoms related to perimenopause. My period, like if you use the word irregular periods, hot flashes, or night sweats, like that's kind of an in for anybody who knows what they're doing.
Yeah.
Sometimes people have symptoms that are more vague than that, but I think just asking the question, I think I'm having these symptoms that may be related to perimenopause. Are you comfortable managing this? Or would you be willing to refer me to someone who is? And, and that way you're coming across as self-advocating, but not patronizing of like, you don't know anything about this. So, that just, it sort of softens it a little bit.
Yeah, I like that a lot.
That way the doctor doesn't feel like, like, no, I don't know how to manage this, but I'll send you to someone who does.
Yeah, no, I really like that. Now, another thing too is women always ask me what tests to get, and there's kind of like two sides to the fence. Some people say, you don't need to have tests. because of course you're during obviously kind of this hormonal chaos during this time. But I have kind of always been under the camp that it's always great to get a little curious about your body. And
Mhm.
there's a time to test. I mean, more the luteal phase, if you are still cycling, and if you do it around that time, and it's around the 21st day, if you still cycle to 28, but that will still give you an indication of kind of how your hormones are operating. I just did my hormone panel again the other day because I'm using testosterone. I wanted to find out what my levels were at. But do you think it still is good for women to get a hormone panel, even if they are in perimenopause? Because some doctors just say, no, don't worry about it. We know where you're at. Or does it just depend person to person? Or kind of what's your take on that when it comes to what panels they should get and should they actually get them?
So I think in midlife, there's kind of, I'll partition this into a hormone question and an overall like general health question. Because when people are coming in symptomatic, a lot of times it's sort of, especially if it's early perimenopause, it's a little bit more insidious. Like I have brain fog, my mood is changing, my libido sucks, like I'm having a hard time keeping up at work, or I'm just like frustrated with everyone at work. And I want to make sure, like, is her thyroid functioning normally? Does she have iron deficiency? Is there a vitamin D deficiency? How much alcohol is she drinking? Is there a blood sugar issue that I need to be concerned about? Because I don't want to attribute everything to perimenopause, because there are other organic causes of some of these symptoms that can sometimes be unreal or revealed in just, a basic set of labs. So that I think is worth investigation. And I do that just sort of as part of my routine care with my patients. Now, as it pertains to hormones, I usually will, if I'm testing someone's hormones, it's with the caveat or a conversation around like, I may not make decisions because and I usually get testing on day 3 to 5 of the menstrual cycle.
Okay. Okay.
And
so it's not luteal then, you're right into menstruate. I wonder what I was always told, like the luteal. Okay. All right.
Follicular, days 3 to 5.
Interesting.
So if I order labs on someone and her estrogen and her follicle stimulating hormone levels come back normal, those are the two kind of big ones that I'm looking at. Am I not going to treat her symptoms because her labs are normal? So it's really like how with any test that I discuss with a patient, because, I can order $1,000, urine metabolite test that will tell you all the metabolites and, what's going on over a 24-hour period. If you want to spend $1,000 on that test, I'll order it. But how is it going to affect my clinical decision-making?
Mm-hmm.
So with testing sometimes, and like when I got tested, my OBGYN was like, let's just look. And my estrogen came back less than like 40 and my follicle stimulating hormone was through the roof. And I was like 42 years old at the time, like crazy. And I was like, oh, that's why I'm feeling. And, and it was validating. So some patients just find that to be validating. However, MSP, as far as I know, won't pay for those types of things unless you're having symptoms like younger than 40. Yeah. So testosterone is a different thing and we'll get into that. But I, as a matter of course, don't necessarily order like a hormone panel per se. Okay. And that's why.
Okay, that makes sense. We're talking about, you kind of touched on testosterone. We're going to dig into testosterone, but looking at libido, because I think if we're going to be talking about testosterone, that's definitely what I want to talk about. Why does libido, and this is going to lead to this next conversation, but why does libido change so much during perimenopause and menopause? And which hormone actually is at play when it comes to our libido?
So there are a lot of things that play into libido, right? And I think of it in terms of you may have heard the biopsychosocial model. So there are biological factors, there are psychological factors, and there are I would say social relational factors, right? And if we're talking about low libido, what's going on with your work? What's going on with your kids? How's your relationship with your partner? Again, how much alcohol are you drinking? Are you making time for exercise? When was the last time you had a break? So again, I don't want to attribute everything to hormones when there are all these other factors at play. Yeah. And many times people in midlife have a huge amount of caretaking responsibility. So they're thinking about kids and they're thinking about partners, they're thinking about elders and work. So I can't medicate someone out of a chronic stress situation that is driving their low libido. Yeah. That being said, I've had patients who I start them on estrogen and progesterone for menopause hormone therapy and their libido increases.
Oh, okay.
I've had some patients that I start on estrogen and progesterone. It doesn't really rock their libido too much, but then we have conversations around testosterone. And that's the thing that does the trick in combination. And this is very important with conversations with their partner about what it is, like, what do you want to explore? Is this a priority for you? Do we need to talk about, the quality and pleasure and trying new things, or dedicating time away from the kids and the responsibilities. So that's where the integrative pieces come together. And I love this topic of women's sexual health, because for me, it's kind of the culmination of physical health, mental health, spiritual connectedness, creativity, and personal expression and confidence. There's so much wrapped up in women's sexuality.
Yeah, no, I love that. Well, and so testosterone kind of gets a lot of the attention for libido, though, correct? So testosterone's everywhere on Women's Social. Kelly Kirkpatrick, if I said her name correctly, she's a really big advocate for testosterone for women. So can you please kind of touch base on why would women want or need testosterone? I actually use testosterone as well. I got mine handy here. It's a cream. What are the symptoms that can indicate low testosterone? And why is there such hesitancy around prescribing it? And what should they know before considering it? So I've kind of given you 4 questions here, but I think you can make that into a beautiful answer for us.
Yeah, absolutely. So testosterone is, beware of anyone who's trying to sell you certainty. And that's true in the wellness space and in the women's health space.
100%. There is no magic pill.
Exactly. It's not for everyone, and it can have significant side effects. Many doctors haven't been trained in the appropriate prescription and monitoring of it. Women's sexual health has never been prioritized in Western medicine. So, we have 26 different pharmaceuticals on the market for men's sexual health and like 2 for women. And so my approach generally is that testosterone is approved for hypoactive sexual desire disorder in postmenopausal women. It's not approved for this in perimenopausal women or premenopausal women. So that's the only thing that it's been approved by the FDA and Health Canada for. And also there are folks like Casperson and Rachel Rubin and me who are like, I've seen patients who are like, this not only improves my sex drive, it like fuels my drive for life. I feel like myself again. And how do you measure that? And who stands to profit from it, right? Is the study going to be funded when the answer is nebulous, and who's going to make money off of it? So testosterone also has significant side effects. And I've had some patients who we try it out and the hair starts falling out of their scalp, or they start growing chin hair or body hair. It can cause at high doses. And I'm talking about like these pellet clinics that put in a pellet.
Yes.
That's a roller coaster that you cannot just wish your way off of when something's implanted in your body. So I strongly encourage folks not to do that. But you can have irreversible voice changes, enlargement of the clitoris. And so this requires a very nuanced conversation about potential risks and benefits. I always measure a baseline testosterone level and then measure it again in about 6 weeks, depending on, like, some people will respond to creams, but some people need a gel because they just don't absorb the cream. Some people apply it labially because they don't absorb it through the skin, but it requires monitoring. The other hesitation surrounding testosterone is that it's a controlled substance, both in the United States and Canada. So as a result of the Olympic doping scandals back in the 80s, testosterone was included on like a scheduled medication list. So just like if I were writing a stimulant medication or an opioid or a benzodiazepine or something like that, that's like a scheduled med, testosterone falls into that category. So there's special considerations around that. So is it going to make you, like, want to have sex all day, every day? Maybe. Is it going to make your hair fall out? Maybe. Are you going to feel nothing? Maybe. So that's really where the partnership and the communication between the patient and the physician comes in, and some patient autonomous decision making too, right?
I love how you just framed all that. I mean, so mine is a cream.
Mhm.
And I actually do it. I think we've discussed this, but I do it kind of the inside of my arm area. I don't like it. I was supposed to do it intravaginally. I didn't like the feeling of it. It just kind of bothered me. So I went and saw a naturopath who then had a medical doctor working with him, and I was able to get this. And now I just get it filled from my medical regular doctor. And I
Mhm.
went back and I'm like, see? And so like,
Mhm.
okay, fine, you can keep going. He's like, does it
Yeah.
make you feel good? I'm like, it makes me feel good. But
Yeah.
they tried to sell me on pellets, which is interesting. And I
Mhm.
remember it was going to be $500 to insert the pellet into like my back hip. And I called him after because it just didn't something in me. I think that's like the intuition we have. I was like, I don't know. I said, how do you know exactly how much I need? I said,
Mhm.
my concern is you insert this pellet, which is $500, so it's pricey. I go, what if you give me too much? What if you don't give me enough? I said, we don't even know where my baseline is yet. Like I've never been tried testosterone. So I would rather do a cream, kind of see how it goes. And I just went for my testing the other day, every 6 months to 8 months, get it tested again, see kind of where my levels are. I know I feel better energetically. I can say that. My libido, I've never had libido at 35. I had zero libido. And I remember going into my doctor, who I still work with, and he was like, but you're motivated, right? And I'm like, yeah. And he's like, well, you're fine. I'm like, okay. And now it's very different. Now I'd be like, wait a second. But I've never had a libido. First time in my life I experienced libido ever, which was like, holy crap, this is what it's like to want to have sex instead of like, oh my God, I have so much stuff to do. Why are you bothering me? I was the one like, hey, muscle as well. I've always lifted weights, competed for years. And of course, when you're going through, I'm in perimenopause, I'm 52 this year. So obviously things are changing, but I had a really tough time sustaining muscle. That's changed a little bit for me as well. I've noticed how about that. And also decisiveness. And that might just also be my age too, where I'm just not putting up with much bullshit anymore, but a lot easier to be like yes and no
Yeah.
instead of like, oh my God, is that okay for you? I don't know. Is that okay for you? And I tended to really always be like, oh, before. So I don't know if that's helped me a little bit too, but I'm a big fan of it. It's worked really well for me. And I think women being able to work with a physician like yourself who's educated in it, who can actually see them through and coach them and have conversations and support them, obviously is really, really important. So anybody who wants to work with Amber, West Coast Women Clinic, just saying.
Yes. And
You
the thing
know?
with testosterone is that it wasn't included really to any meaningful degree within the Menopause Society certification exam. I've
Yeah.
done probably close to 20 hours of continuing education just on testosterone. And
Yeah.
the Menopause Society meeting has, additional ongoing training. Ishwish has additional ongoing training in this. And it's something that, a lot of this stuff is a moving target.
Yeah.
So, and that's true not only with testosterone, but sort of like all of
Yeah.
the health, longevity, hormone stuff. Like,
Mm.
and this is why I caution people to beware of someone who's trying to sell you certainty, because
Yeah.
one of the things that I tell patients is like, everybody's situation is a little bit different. And I understand that people are having a hard time accessing care, and that there are these like online platforms that are cropping up, and you fill out a little questionnaire and somebody prescribes you medications, and nobody's really checking in on you to see how it's
Yep.
going. But it's it's cheaper, right,
Yeah.
than coming to a private clinic like where I work. But there's so much nuance to this. There's so many conversations around risks and benefits, and adjustments that need to be made. And if the patient requests a trial of treatment and I sort of like lay the cards on the table and she makes that decision, like, this is, to me, medicine is a partnership, and that's what makes
Yeah.
this type of practice sustainable for me.
Yeah.
But I know that not everyone has access to that, and
Yeah.
so we do our best. But yeah.
Well, and I think if you don't have access to work with somebody as in a private clinic, and you are working with your doctor, I think really looking at all aspects, because that's one of the things you look at when you're working with the women you're working with is their lifestyle, their relationships. I mean,
Yes.
the thoughts like we have 5 pillars of Erin Walls: the thoughts you think, the friends you keep, daily movement, nutrition, and supplementation. Just
Mm.
like you can't MHT out a bad lifestyle or take a bunch of vitamins and not work out, not take care of yourself, and not sleep well. Like it's
Mm.
all of these things together. And so if you're someone who maybe can't have the one-on-one care
Mm.
as a private clinic, then you really have to be like, okay, I need to be my own advocate. And because this is your life, this is your body. right?
Yeah.
So you can't be like, well, I don't have anybody. So therefore, it's like, no, we kind of all know nutrition. Eat
Mhm.
whole foods, protein, like the basics, water, all those things. So start taking it upon yourself to really look how you can advocate for yourself with lifestyle, relationship, nutrition, training, and trying to work that in with a program if you have to work with a deaf family physician that maybe you don't have access to work one-on-one with somebody in a private clinic. Would you agree with that, I'm assuming?
Yeah,
Yeah.
the whole equity and access thing, I think, and I really struggle with this
Yeah.
because, there are systemic things both in the United States and in Canada where certain populations of people just don't have access to the types of resources that we do. And, I want to be mindful of like putting too much responsibility on people who are kind of systemically deprived of
Yeah. No, I agree with that. Yeah.
and also, one of my big things, and I tell everyone who walks in the door, like if you're drinking more than zero alcohol and you want to improve your metabolism and your mental health and your sleep
Yeah.
and your weight, you should really not drink.
Yeah.
And so there are certain things like that where it seems intuitive, and also, there's systemic stuff too.
Yeah, no, I agree with you. I agree with you on that. What is one thing you wish women would start doing sooner? If you kind of look at the lifestyle, I guess, component or every component, really.
I think it so much hinges on education, and I take care of patients. My youngest patient is 11. My oldest patient is 78.
Wow,
Yeah. So
wow.
I take care of women and girls across the lifespan.
Mhm.
And one of the things that I do with my adolescent patients is I actually show them, and I do this with my perimenopausal patients too. Like this is a chart of the menstrual cycle, right? And I describe the follicular phase, the ovulatory phase, and the luteal phase, and what that means for her hormones, what it means for her moods, what it may mean for her workouts and her sleep and her receptivity to sexual advances and all of it. And I think just knowing like, oh, I'm in my luteal phase right now. Like I need to set realistic expectations and maybe communicate to my partner that I'm feeling some kind of way and need to receive care at this moment.
Mhm.
But I think just having an awareness of like your body's natural rhythms and paying attention to that.
Yeah.
And also like I am kind of in the season right now of like doing less to do more, and
Mhm.
sitting in presence and being mindful and listening to my own body's reactions to a variety of circumstances, right? So it's
Yeah.
like my heart rate's elevating a little bit, or like
Mhm.
every time I leave this company of this person, I'm feeling a little more edgy.
Mhm.
I think it's just like learning to listen to your body instead of like reaching for a drink or reaching for your phone
Yeah.
for that dopamine hit, like
Yeah.
trying to escape what's happening in here and really like tuning in and paying attention to what's happening.
Yeah. 100%. I was speaking of I have a 17-year-old, Michaela, and I remember it was a few months ago. She was walking from like the bathroom to her bedroom. And what did she say? She's like, oh my God, I hate it when I'm in my luteal phase. I feel like such crap or whatever. So she's walking in the bedroom. And I was like, she knows what her luteal phase is. I'm like, I love this because I had no clue, and
Yeah.
I'm thinking it's so cool that she actually recognizes her luteal phases before her period. And it can cause her to be a little bit more hormonal or have a little more acne or just feel kind of not feel like 100% herself, or she might be a little more bitchy. So I was like, that's so great that she recognizes that at a young age and how that's going to serve her, especially if she can have those conversations with her spouse as well, whoever that may be, or friends or wherever. Just vocalizing that is really, really important.
Absolutely. I have a friend whose partner started tracking her cycles on
I
an
love
app on
that.
his own so that he could be a better partner for her. I'm like, can we
Wow.
teach this to men, like straight
Right?
too? Like,
Yeah.
how much better would the world be if
Right? That'd be so much better.
understood?
Yeah,
So,
I love that. Okay, so we have some rapid fire questions.
okay.
What is your go-to comfort food or treat?
Indian food. When I was a resident, there was this little place
Oh,
near the hospital called Mount Washington Pizza, and it was owned by an Indian family, and they made the best chicken tikka masala.
oh, okay. I love Indian food too. There's a great place on West Fourth I'll tell you about. What is your favorite swear word?
Fuck.
Love it. Me
because
too.
it can be used in any context.
Any context, right? So great. What's one book or podcast that's inspiring you right now? Or practice? You can say practice too.
Yeah, I'm just practicing presence,
Yeah.
and practicing being enough.
Yeah, I love that. What is one thing you would tell your 20-year-old self?
Invest in Google.
Oh, I love that. That's so great. He's always like, believe in yourself. That's a good one. That's a good one.
Yeah.
I
Yep.
like that.
If I had
Smart.
done that in 1999, I would be retired on a yacht by now.
Very true. Damn, I never thought about that. Okay. So where can people find you? I know you have your Substack.
Yeah.
So where can people find you? Give us all the deets where people can find you.
So for clinical encounters, I'm at the West Coast Women's Clinic. I'm only licensed in BC, so I can only practice in BC. I can't prescribe outside of the province or in the States. And I am exclusively on Substack at Under the White Coat. You can find that at dramberhall.substack.com. Awesome.
I love it. Thank you so much for today. This was a wonderful conversation. I know the listeners and viewers got so much out of this. So I'm sure I'll have a lot of questions coming from women after, or I'll direct them towards you. So
Excellent.
Thank you for this.
Thank you so much for the invitation. I really appreciate it.
No, thank you. And thank you everybody for listening. And we'll see you next time on The Friends You Keep. Hey, wait a second. Before you go, we would love to extend a special 20% offering off any one of our Health Canada third-party tested all-natural support supplements. Simply head over to erinwellness.com and enter the code ERIN20. That's AERYON 20 and take advantage of this special offering to you.